Amputation was a very important medical procedure during World War I. This frontier of amputation was the reason thousands of soldiers had a higher chance of surviving. The amputation frontier was invented in the 1st century, but amputation was commonly used in the 20th century during World War I. Archduke Franz Ferdinand of Austria was assassinated on June 28, 1914. After that, World War I started on July 28, 1914, when Austria-Hungary declared war on Serbia. Within a week, Russia, Belgium, France, Great Britain, and Serbia had lined up against Austria-Hungary and Germany, and that's when the frontier of World War I had begun. It mainly took place in Europe. Germany began fighting World War I on two fronts, invading France through neutral Belgium in the west and confronting Russia in the east. Many thousands of limbs were amputated by doctors to save lives. It is estimated in Germany that the number of amputations totaled 67,000 and 41,000 in Britain. Many of the soldiers believed that they would rather die than be maimed, but the doctors at the front saved many thousands of soldiers through amputation. Limbs were amputated for a number of reasons. They were often shredded as a result of shrapnel, fragments of a bomb, shell, or explosions. Machine guns shattered bones in arms or legs. Compound fracture, where the bomb was shattered and projected through the skin, was a complex wound, and the limbs were often amputated. Often, there was no bone left to join together, and the threat of complications such as infection meant that amputating the limb was much safer for the patient. On the Western Front, amputations were conducted in cases of trench foot, which was caused by poor foot hygiene and immersion in trenches full of water.
When soldiers would come to nursery tents, one of the most common accidents was traumatic amputation. Traumatic amputation is the loss of a body part due to an accident or injury. Traumatic amputation was solved by amputating above the injury to make a clean cut, to make it look neater. We see the clean cut made above the skin and tucked in to make it look neater. Traumatic amputation was not only affecting the body, but it greatly affected the mind. The scarring or trauma from the injury made the soldiers mentally unstable. Due to all of the surgery and pain, soldiers suffered from insanity, depression, and severe anxiety. Soldiers were almost terrified to look at themselves with the stumps. The stumps reminded them of the pain and suffering loss of their limb. The stumps are the remains of the limb. During World War I, amputation was performed using a guillotine. During the Battle of Somme in 1916, Marmaduke Shields, a senior consulting surgeon who treated many military casualties after they returned to England, wrote that post-amputation pain was a source of intolerable suffering to his amputee patients and a despair to those who fit them in artificial limbs. He later called for surgeons not to use the guillotine method, reporting that it left nerves exposed, causing both stump pain and poor prosthetic fit. In the following year, fellow surgeon Captain Huggins advocated a two-stage amputation, with surgeons in Britain performing a second procedure to reduce pain after the initial operation at the front.
Today, instead of resorting to amputation in the first instance, surgeons use a technique called debridement to remove soft tissue, preserving as much of the limb as possible. Phantom limb pain, which is the pain the soldiers felt in their missing limbs, is now understood to be a consequence of how the nervous system adapts to damaged nerves and the loss of a limb, and affects around 59% of amputees. However, it is still poorly understood and difficult to manage. World War I was the war of trenches. Artillery and machine guns forced the armies on the Western Front to dig trenches to protect themselves. The trenches were long, narrow ditches. The soldiers would live there and sleep there. Over the next 4 years, both sides would launch attacks against the enemy's trench lines, attacks that resulted in horrific casualties. Despite the use of wooden planks, dug boards, and sandbags to keep out the water, soldiers on the front lines lived mired in mud. The constant dampness often led to a condition known as trench foot, which if left untreated, could require amputation to stave off severe infection or even death.
In Paris of 1917, Augusta Decorin-Klumpke, a neuroscientist, arrived for work. Her work was at a hospital ward for injured soldiers. Everyone in the row of the beds had lost limbs in the war, but men were fitted with new limbs made to fit their stumps properly. But when they went home to their families, their stumps started to swell and become red. Manageable pain became unbearable and their new limbs simply wouldn't fit anymore. The patients were back in the wheelchairs and crippled. No one could understand why. Doctor after doctor handled their stumps, prodded and poked them, and then stood confused. There was no infection, no nerve damage, no reason why the restoration could be failing. In the year of the war, the neuroscientist Augusta made a breakthrough. She had been taking x-rays of the failing stumps, one of the first uses of x-rays in medical research.
It had been noticed that what had once been neatly healing bone ends were now jagged and rough. It wasn't the bones themselves that had grown over, it was the tissues surrounding the bone, nerves, blood vessels, and especially muscles. What had once been soft tissue was becoming hard tissue, becoming bone itself. This new hard tissue affected the nerves and the stump, causing it to swell and become painful, destroying the neat profile that had been used for the prosthetic fit. Augusta noticed something else. All the soldiers had been injured in the same way. They had not been injured by gunfire or stabbed. They had all been brought down by a powerful blast of a heavy shell fired from a large artillery weapon. Augusta theorized that it was not only the metal fragments and shrapnel that had injured the men. The actual blast wave energy of the explosion had also somehow affected them, and was still affecting them long after their original injuries had healed. Then in 1918, the Great War ended. Augusta died in 1927, and her conclusions in patient subjects faded away. Almost a century later, in another war where soldiers lost their limbs to high explosive munitions in mines and improvised explosive devices, or IEDs, the medics began to notice that their amputation stumps were not healing as they should. Expensive custom-made prosthetics stopped fitting after months or a year's worth of normal use, and stumps became malformed due to pain and swelling. Again, scans revealed inexplicable bony growth along nerve shafts or blood vessels or in muscle mass. It wasn't the bones themselves, but the soft tissue around the bones churning hard. There is a name for this now, heterotopic ossification, or HO. It is experienced by an injury. Scientists seek to understand the full range of physical consequences of an invisible killer, the blast of a high explosive shock wave. At the 11th hour on the 11th day of the 11th month of 1918, the Great War ends. At 5 a.m. that morning, on November 11th, 1918, Germany signed an armistice agreement with the Allies in a railroad car outside Compiègne, France. The First World War left 9 million soldiers dead and 21 million wounded, with Germany, Russia, Austria-Hungary, France, and Great Britain each losing nearly 1 million or more lives. In addition, at least 5 million civilians died from disease, starvation, or exposure. World War I was known as the war to end all wars because of the great slaughter and destruction it caused. Unfortunately, the peace treaty that officially ended the conflict, the Treaty of Versailles of 1919, forced punitive terms on Germany that destabilized Europe and laid the groundwork for World War II.